Hey everybody, welcome to another podcast. We are excited today to be kind of sharing a little bit about why we're doing what we're doing and how that is improving the quality of life of physicians and providers. So, Amy, what do you have to say about this?
It's been quite a year, and I knew going into this, I did a lot of research about direct primary care, and obviously there was a burning pain in me.
Are we like 4 years ago when you were kind of, well, you've been thinking about it for a while.
At least 3.
Yeah.
And, but I just did not anticipate how wonderful it was going to be. I heard all these physicians who had stepped out and did this. And we wanted to, I think, just share our story, but also maybe incentivize and motivate other providers, because I can't tell you the number of physicians, once they've heard that we've done this, they're like, oh, I would love to be able to do something like that. And don't get us wrong. I mean, any starting your own business and all this, there's always just new endeavors take on new challenges
and growing pains.
Exactly, growing pains and a lot of firsts. I didn't think when I went into medical school I was going to become a business person and an entrepreneur, but thank goodness I've got you by my side helping, and
that does help.
I think just maybe sharing what was the burning pain.
And it intrigued me out of the gate, because I was like, okay, what do you want to do, right? When we were like wanting to make this change, and because the kids were, off to college and all that stuff.
Mm-hmm.
And yeah, that was the first time I think I'd kind of heard of direct primary care. So I don't know if you're wanting to define that at the high level, because you've kind of changed it a little bit and molded it into what you love, which is obviously it's your own practice.
And I think that's probably the most exciting part of it all, is that after practicing medicine for, over 26 years, 28 years.
I was going to say it's longer than that.
Yeah, I can't. Well, medical school, it's been 29.
Since 91.
30.
Yeah, when
it's
you
been
started
a long time. Oh, well, that's a good point.
Mm-hmm.
But out in private practice and all of that, I just think being able to, the whole reason I went into medical school was to work with patients, right? And as we're going to get into what has led us to get to a point of wanting to change, and what we see out there is physician burnout.
It's real.
It is extremely real, and I am so fortunate to still be in this position where I absolutely love my job. I love medicine. I love what I do, and I was getting to a point where that wasn't the case. I was almost waking up with this dread when I would go into the office, and there were a lot of reasons for that were totally out of my control. And now, like you said, I can mold it into, this direct primary care model has really allowed me to mold it into what I know medicine should be for me and my patients, for the practice that I can serve people the best. And so direct primary care is literally just directly working with the patients outside of insurance. And there's usually a monthly membership. And, there's a monthly membership. It's different than concierge medicine. There is in all direct primary care models. There's a monthly membership.
Or the physician doesn't get paid yet.
Good point. And so, but this model, our last podcast, if you haven't heard it, is a good chance to go back and really get the nitty gritty on the history of direct primary care. Right. But this model really just takes away a lot of the go-betweens and the hurdles that impair the physician to be able to directly work with the patient, and the patient to directly work with the physician. And that's what was so exciting to me. I'll go through this, but the job satisfaction, the time that I've gained, my own health, more work-life balance, and that is really why physicians get to that point of burnout. And this direct primary care model really opens the door where physicians can have this. And I think we just think, well, we signed up for this. This is what it is, right?
It is interesting to watch you as a physician. Of course, you've had the vision of being a physician for a long time, right? I mean, in
I was
college
young.
and maybe inspired by your sister in high school.
As a little girl,
and
even.
stuff. And so you have a vision of what it's going to look like. And I think out of the gate, maybe as I'm just witnessing and watching your journey, there was a lot of excitement getting out, and I think there was a lot of autonomy for you to do what you wanted initially. But as I've watched you through the years, that was getting peeled away to not a lot of autonomy, which means your vision it just kept getting taken away, and it was being run more like a business, more so than the care and the relationship that you would have with your patients, which you value immensely. And it makes you unique and different, I know, as a physician across all the physicians we know.
Well, and it is. Medicine healthcare has become a business, and dictated a lot by insurance companies, and so what I think
they probably have good intentions, but it really steals the relationship of the physician and the patient.
Well, I mean, some statistics that you can't deny: 60 to 75% of a typical primary care physician insurance-based office, that staff, almost 3/4 of the staff go toward managing billing and the insurance and all of that. So it's a huge overhead. There's a lot of, you have to pay this overhead, and that is usually paid by the physicians getting people in the door. So the more we can get in the door, more we can cover our overhead. And so it does create this revolving door where, the average physician spends, I think it's 15 to 17 minutes with the patient. And that's average. So some are shorter, and some
you
are
can see the
a little
complexities.
longer.
The physician office got larger and larger with staff members, that you would need someone to manage all of that. So you could see where it created almost its own dysfunction that has led to what you're wanting to talk about today, which is the burnout, and then also the ability to correct. In your journey of us coming together, that you've corrected that immensely from where you were just a little over a year ago.
Well, unfortunately, 92% of physicians report burnout at some time in their career. That's huge. And that's not just having a bad day or having a bad week. I mean, there's statistics on the definition of burnout. I think you were even looking through some of that. But, it's just basically where it's really impacting your attitude, your job, your energy, your passion, your joy, and your purpose. And you lose sense of that. And that's pretty sad if 92% are feeling that. Starts with medical school, honestly. Medical students have rates of depression 15 to 30% higher than the general population. And that's huge. And that's clinical depression.
It would be hard for most people that have not been through that to understand what that looks like. I mean, it was one thing for me to witness medical school and then even the residency. And you went through it at a time where there was regulations on it, but there was no regulations on it. Hours and everything.
They are becoming more mindful of these statistics,
kind of,
to hopefully help these
students. Because our son's
students.
in it, and so
It's still, I mean, being a physician is and always will be a stressful job, right? You're taking on a lot. We're dealing with hurt and sick people and death and life. And but it can also be so fulfilling. And usually people that go into this, they know what they're signing up for, and they go in openly wanting that responsibility and that relationship with the patients, but also that intellectual challenge. And so, I think people go into it knowing stress is inescapable as part of it. But the problem is, and I was going to talk about this under life balance, but I'll jump in now on this. We're not taught that in medical school. We're not taught any of these skills for life balance. And in fact, we're actually, especially in residency, we're taught the opposite. We learn that, you have to ignore your physical and emotional and spiritual needs at that time. You don't need to eat, or, you don't have time for that, or no time to take a break for the bathroom or to take a break at lunch. And it's kind of, we feel like almost guilty, and you feel like it's a sign of weakness or something. And so I do think the problem is then we carry these negative habits into our career and our practice, because we do just kind of brainwash ourselves and get brainwashed in the system into thinking that this is normal and expected. And so, I did it myself. I lived like that for so long. And then when you step out of that, and it was hard for me, you've seen it, like I've had to almost retrain my thinking and say, I can block an hour and a half for lunch, or I can block, it's important, because that never means you're going to have an hour and a half. Something always runs over, but you need a break. You need lunch. You need to eat. You need to drink your water.
Right.
You need to sleep. All of our four pillars.
So that you can hit the afternoon at your highest level.
And also,
sure.
It's just these margins that
we meditated Tuesday.
We did at lunch. Yeah. Yeah, I know. It just
Wednesday.
floors me
Wednesday.
that, and I always had great intentions. I tried so hard at my old practice to get you in to do yoga once a week for our staff, but we couldn't even get all the staff together once a week for 15 minutes. So again, as you see, just so much. It's so complex. And they are, the American Medical Association and our societies are really focusing on physician burnout, and they're trying to bring more awareness. Suicide deaths are rising in physicians. It's awful. 250 to 400% higher among female physicians when compared to females in other professions. That's awful.
Right.
I mean, several hundred physician suicides occur per year. And it doesn't make sense that it could get to this point. I know of a couple physicians that we lost through that. So it's really sad to think of the time and the dedication and the years of sacrifice and the training and the money and everything and all the investments to get to that point.
Right.
So,
yeah, there's definitely an out of balance at that point. And so, and you know that this burnout is causing a lot of that. The body gets out of balance, and next thing you know, we're not making as good decisions as maybe we used to. So trying to eliminate the burnout would obviously help to eliminate that, for sure.
But the exciting thing is, this is a growing trend, this direct primary care movement, and
that's why we're here today, right? To celebrate
it is. It's so exciting, and there's the direct primary care podcast, or I think it's called My DPC Story, and it's so exciting to hear physicians sharing their story of their journeys and what brought them into direct primary care, and just all the benefits they've reaped from this. And so hopefully, whether it's this specific model or, what it is, I hope this just allows providers to realize that it doesn't have to be this way. And you can feel fulfilled and happy and joy and find balance in life. And it's
been fun to watch.
It's amazing.
And I you love to say that word joy, because it's what it feels like, that you do have a joy about what you're doing, total autonomy over how you practice. We have had, and that's what our prior podcast was about, was the benefits of what we're doing today to the patients, and it's just overwhelming, right? It's everybody absolutely loves this model. So
it is.
And you did it.
And I think that's the number one thing, is just like the job satisfaction. I'm truly practicing medicine. I'm doing what I went to medical school to do. I'm not spending the hours that I used to spend worrying like, oh gosh, if I don't have all of these metrics documented, yes, my patient had their mammogram and colonoscopy, but if it's not scanned in this proper area, or I didn't click this box, or I didn't put one of the 100,000 ICD-10 codes correctly, which those are like codes that we use to say like what their diagnosis is and to get paid, by insurance.
Like you might put in diabetes, and then there's still 100 to choose from.
Yeah. So, that's it. It's I'm not spending that time. I want to make a change, and just the biggest reward that I have received, and it's been amazing time with patients, time to practice better medicine. I can feel more content at the end of the day that I've really had time to dive in, to listen, to just have time to research later, time to make phone calls, time to just do medicine. And also time for myself, time for self-care. I think we're very poor at that as physicians. We don't take time to think about our four
You
pillars.
have walked your dog a lot.
I've walked my dog, I know, a lot. I have more time to exercise for our move pillar.
That's right.
The breathe pillar, stress was so high that it was just causing issues with my sleep.
Do you just get to the point you just accept it? It's like, okay, this is it. And you're like, there's just no way of getting around it.
Again, I mean, you go back to medical school, like what it takes to get accepted. You have to have straight A's. You have to study all the time. You have to make a lot of sacrifices. And there's a lot of delayed gratification. I mean, you spend your entire 20s studying and going to school, and then going into residency. And then by the time you're done with residency, around 30, you kind of just think that that's what it takes. And again, it goes back to the whole thing. It is a huge responsibility. And so part of that self-sacrifice and all of that is an essential part of our job. And I still do it. I still bring work home. I still worry, and I still sometimes work more than I should. And that's something I'm working on. But I'm so much more balanced. And so I'm healthier. I can be a better physician to my patients. I can be more present.
And you're an example, I think, as well.
Mm-hmm. Right. I can be an example. I can tell them, show them what these four pillars are doing in my life and how it's bringing me more health. I mean, I can't even tell you the number of patients that I used to see in my old office, and they would be like, well, don't take this the wrong way, Doc, but yeah, you were looking tired, or I could just see you weren't as happy or you weren't as healthy. And so if they haven't seen me, maybe we've had a few that have trickled in the past few months, and it is kind of funny to hear their take on what they watch me. They've been with me, a lot of them, 10 or 15 years, and just they're really happy to see that part of me too, just the happiness and the health. And
I think that's interesting, though. Is it the fact that you are in this office, or is it the fact that you're with me more often that you're happy?
It's both. You do make me laugh a lot, which is good for our health,
that's
right?
Yes,
it is. So yeah, I just want to be, I think, an inspiration to other providers out there that you can be happy, you can love medicine and practice medicine the way that you always dreamed you wanted to. You can have work-life balance. So many times, I mean, it's still something that I have to work at, but so many times with my prior career and that system that I was in, I mean, gosh, you can only fill your plate so full. And when it's so full and overflowing and you're just trying to juggle all the time. And so I was telling you, it was like, what's the old saying? Rob Peter to pay Paul. I felt like I was bouncing back and forth between that. I'd be at home, and then I'd be like thinking about work and feeling so guilty and and then I would be at work, and then I'd be like sneaking away and multitasking or trying to run and do something that I was supposed to have done for home or the kids, or making a list or checking into things or ordering things. And so what I did is I robbed myself. I robbed my sleep. I always exercised and I tried to eat right, but the stress and the sleep pillars.
The stress is the one that gets you. If you're doing our four pillars, breathe, eat, move, sleep, and you're really terrible at stress, it almost doesn't really matter. Mm-hmm. I mean, it does, but it's such a big impact, profound impact on our health, stress.
Well, think about it too. I mean, when you're in that constant fight or flight state, I think that was part of it too. Like the longer you do it, then it just really starts wearing on you. All that adrenal stress and the lack of sleep and all of that. And so I think what happened is then I started getting sick a lot. I developed an autoimmune disease. I mean, it's interesting looking back at residency, how many physicians I had miscarriages, preterm labor, how many women physicians do have complications in pregnancy, and it's all from the stress. So anyway, on and on. There were just a lot of effects on my health, and I thought I was taking great care of myself. But again, you can't negate the stress and the lack of sleep and all that.
So you would say that this new model is definitely getting you in the right direction for lower stress, opportunities to spend time on your work-life balance, see patients and care for them in ways that you haven't been able to do for a while. It's always been your vision, but now it's happening.
Mm-hmm.
It is fun to watch you, the joy that you have with being able to do all of this at one time, right? There is really almost no sacrifice from what your vision was for being a physician, work-life balance, the ability to integrate in with family and all that is, and your stress is definitely a lot lower, considerably.
Sure is.
So I think one of the things too, we are a little over a year in this, have had amazing success with integrating this vision. And I don't know what it'll be in a couple years or 2 more years or at a 3-year mark. We would love to say that if you're listening to this as a provider and this is something that sounds right, we want to show this to other people so that it's doable, right? That it's possible for them to change. So if you're listening to this like, yes, I want that, we would definitely be open to helping you see the path and getting you to where you are as a physician in your quality of life today.
Yeah, we've learned a lot along the way, and I think just keeping it to a small employee model and small patient base.
And now we have one more.
We have one more
person,
nurse practitioner working with us now. So,
but amazing.
I think just having that, everything that we learned, and it's great. Physicians that are doing this model are sharing with each other and really trying to encourage and support each other because, we want others to find this joy in their career and this passion and this just joy and health in their own life so that they can continue to have longevity in this field. Because what's happening is the burnout, physicians are choosing other avenues. They're quitting medicine or they're doing non-clinical or they're retiring early. There's all kinds of things and we need physicians. And so again, we also want to be a model to medical students and residents. And I'm excited. We've been having some students come in and I think they're just like, wow, I didn't know medicine or an office could be like this. And they love it. They love spending the day with us, and the patients love it. So, it's really exciting.
All right. So, if this is, sounding right to you, definitely send us a comment, on YouTube. Hit the subscribe button, share it with a buddy, give us a thumbs up because we're excited that this has an opportunity. What we're doing and how we're caring for patients is to move our healthcare model from a sick care into this true care model, right? And that's what we see every day is like we are adding to the care, to the health of our patients. And I know if you're a physician listening to this, it's like, well, yeah, that's what I want to do too. I think the question is, are you doing it to the level that is really needed with your patients? And I know what we're doing today is really maximizing that to the patient.
It is. It's not. I think a lot of times, like you said, it ends up being sick care or you feel like you're just patching things up until you can get them in again because you don't have enough time to address all the issues. And this model really allows you to see the patients get well or be on these paths and just see all the successes week by week. And that is so fulfilling too, is just seeing the changes that we're and the impact that we're having in people's lives, and the patients' lives. And so it's really fulfilling. And you're right. We can hopefully spread this word and get more people out there having this experience.
It's going to happen. Well, thanks for sharing all this today, Amy. I know
Yeah.
it's impacted you, and you would imagine that to afford this to all of your other peers as physicians is the right thing to do, which is why you were wanting to share this.
Yep.
All right. Well, we are wishing you guys a wonderful day. Take care. We'll see you.